I'm sitting here, confessing to Father God. We had a bet and I lost. Remember, I was praying for a C in the hardest class ever. Well, he's been hinting ADHD, and I was thinking, great topic. And CJ has it too, so I can advocate. And he had said, no, for yourself. And I went, what? And he goes, now watch what I do with your prayer. And so I went to go take my finals. And he said, I will make the topics on your final that you keep putting off, by the way, directly relatable. And instead of multiple choice, it will be essay questions. And the first one was Opinimus, the fall from grace, pride comes before the fall. And then the poem where I had to analyze where the woman was wanted so bad a moment to herself because she was overwhelmed by raising her kids and cleaning her house and her to-do list. And then the other one was the guy that had spent so much time on just social media that he was anxious about seeing people, especially people he hadn't seen in a long time, face to face. So, and then extra credit, because she said, okay, I'm going to give you extra credit if you went to the writing center. And I'm like, well, I went there 4 times. So I'm like, yay! So plus all the pauses, to put this topic off, I'm like, okay, I may have it, too, and CJ. I'm beginning to think even Tatiana has it. And what's worse is they got it from me. So, let me give you my bit on ADHD, because it's very common, apparently. So, attention deficit hyperactive disorder is one of the most common mental disorders affecting children. Symptoms of ADHD include inattention, not being able to keep focus, hyperactivity, excess movement that is not fitting to the setting, and impulsivity, hasty acts that occur in the moment without thought. ADHD is considered a chronic and debilitating disorder and is known to impact the individual in many aspects of their life, including academic and professional achievements, interpersonal relationships, and daily functions. ADHD can lead to poor self-esteem and social functioning in children when not appropriately treated. Adults with ADHD can lead to poor self-esteem and social functioning with children. When not appropriately treated, adults with ADHD may experience poor self-worth, sensitivity towards criticism, possibly stemming from higher levels of criticism, possibly stemming throughout their life even. An estimated 8% of children and 2% of adults have ADHD, and it's often first identified in school-age children when it leads to, disruption in the classroom or problems with schoolwork. It is more commonly diagnosed among boys than girls, given differences in how the symptoms present. However, this does not mean that boys are more likely to have ADHD. Boys tend to present with hyperactivity and other internalizing symptoms, whereas girls tend to have inactivity. Many children may have difficulties sitting still, waiting their turn, paying attention, being fidgety, and acting impulsively. However, children who meet diagnostic criteria for ADHD differ in that their symptoms of hyperactivity, impulsivity, organization, and or inattentive, or inability to be attentive, which would be inattention, is greater than expected for their age or developmental level. So these symptoms lead to significant suffering and causes problems at home, at school, or work, and in relationships even. The observed symptoms are not the result of an individual being defiant or not being able to understand tasks or instructions. There are three main types of ADHD even. Predominantly inattentive or hyperactive, impulsivity, or combined presentation, a diagnosis based on the presence of persistent symptoms that have occurred over a period of time and are not noticeable over the past, but longer than 6 months. So while ADHD can be diagnosed at any age, this disorder begins in childhood. When considering the diagnosis, the symptoms must be present before the individual is 12 years old and must have caused difficulties in more than one setting. So, for instance, the symptoms can not only occur at home. The inattentive type refers to challenges with staying on task or activities, such as during lectures, conversations, or long readings. Does not seem to listen when spoken to, i.e., seems to be mentally elsewhere. Does not follow through on instructions and doesn't complete school work, chores, or job duties. May start tasks but quickly loses focus. Has problems organizing tasks and works, for instance, does not manage time well. Has messy, disorganized work, misses deadlines. Well, thank God I haven't done that, right? I'm thanking you now for that. Avoids or dislikes tasks that require sustained mental effort, such as preparing reports and completing forms. Often loses things needed for tasks or daily life, such as school, papers, books, keys, wallet, cell phone, and eyeglasses. Is easily distracted. Forgets daily tasks, such as chores and running errands. Older teens and adults may forget to return phone calls, pay bills, and keep appointments. Hyperactivity refers to excessive movement, such as fidgeting, excessive energy, not sitting still anyway, and being talkative. Impulsivity refers to decisions or actions taken without thinking through the consequences. For a diagnosis of this type, ADHD, 5 to 6 of the following symptoms occur frequently. So, fidgets with or taps hands or feet, squirms in seat, not able to stay seated, runs around or climbs where it is inappropriate, unable to play or do leisure activities quietly, always on the go as if driven by a motor, talks too much, blurts out an answer before a question has been finished, or blurting out, finishing other people's sentences, or can't wait to speak in conversations, has difficulty waiting for his or her turn, such as while waiting in line, interrupts or, what does he say? Intrudes on others. Older teens and adults may take over what others are doing. Then there's the combined type. This type of ADHD is diagnosed when both criteria for both inattentive and hyperactive impulsive types are met. ADHD is typically diagnosed by mental health providers or primary care providers. A psychiatric evaluation, will include a description of symptoms from the patient and family history of medical education, environment, and upbringing. It is important to note that several conditions can mimic ADHD, such as learning disorders, moods, anxiety, substance use, head injuries, thyroid conditions, and the use of some medications like steroids. ADHD may also coexist with other mental health conditions, such as oppositional defiant disorder or conduct learning disorders or general anxiety disorder. Okay, so that makes more sense. So it's like, okay, scientists have not yet identified the specific causes of ADHD, while there is growing evidence that genetics contribute to ADHD. And several genes have been linked to this disorder. No specific gene or gene combination has been identified as the cause of the disorder. However, it is important to note that relatives of individuals with ADHD are often also affected. There is evidence of anatomical differences in the brain of children with ADHD even. It says, in comparison to other children without the condition. For instance, children with ADHD have reduced gray and white brain matter volume and demonstrate different brain regions or functions even during certain tasks. So several non-genetic factors have also been linked to the disorder, such as low birth weight, premature birth, exposure to toxins, examples like alcohol, smoking, and lead during pregnancy, or extreme stress during pregnancy. ADHD and school-age children, teachers, and school staff can provide parents and doctors with information to help evaluate behavior and learning problems, and can exist and assist with even behavioral training. However, school staff cannot diagnose ADHD, making decisions with the child health care clinician. That's up to the parent to first do that part. So students whose ADHD impairs their learning may qualify for special education under the Individuals with Disabilities Education Act. Children with ADHD can benefit from study skills instruction, changes to the classroom setup, alternate teaching techniques, and modified curriculum even. ADHD in adults. Many children diagnosed with ADHD will continue to meet criteria for the disorder later in life and may show impairments requiring ongoing treatment even. However, sometimes a diagnosis of ADHD is missed during childhood. Many adults with ADHD do not realize they have the disorder. Behavior management strategies such as ways to minimize distractions and increase structure and organization and support from immediate family members can also be helpful. ADHD is protected. It's a disability under the Rehabilitation Act of 1973 and the Americans with Disability Act even, ADA. This means that institutions receiving federal funding cannot discriminate against those with disabilities. Individuals with symptoms of ADHD can impair even in their work setting, so they may qualify for reasonable work accommodations under ADA Act. All right, guys, I'm going to get going. Great talking to you. Talk to you soon. Bye.